बहुत ही शानदार क्वेश्चन है कि मास्टर हैनीमैन ने किस एफोरिज्म के फुटनोट में पैलिएटिव ट्रीटमेंट के बारे में जिक्र किया? तो बता दें 67 एफोरिज्म में Organ 5th and 6th edition, Dr. Samuel Hahnemann discussed the scope of and justification of palliative treatment. यद्यपि एंटीपैथिक उपचार के बाद बीमारी का सेकेंडरी एग्रेवेशन आता है, लेकिन अचानक उत्पन्न होने वाली जान स्थितियां जैसे डूबना, दम घुटना, अचानक बेहोश होना, जहर खाना, जहाँ होम्योपैथिक दवा कार्य करने का समय नहीं होता, वहां जान बचाने के लिए पैलिएटिव उपचार का न्याय संगत और आवश्यक है। अफ्रीजम 26 में लॉ ऑफ क्यूर है। 78 में टू क्रोनिक डिजीज के बारे में बताया है। टू क्रोनिक डिजीज एफिजिमल 67 में केस टेकिंग से संबंधित है। विच अमंग द फॉलोइंग हैज द हाईएस्ट एयरवे रेजिस्टेंस? मीडियम साइज्ड ब्रोंकाई। Alveolar duct. These belong to the respiratory zone where the total cross-section area is extremely large, making resistance minimal. Which one of the following ankle brachial index value diagnostic peripheral artery disease? Ankle brachial index is calculated by dividing the systolic blood pressure at ankle by the systolic blood pressure in the arm. BP ankle upon BP arm. Value is less than 0.90 is highly sensitive and specific for diagnostic band. अगर ABI की वैल्यू मोर देन 1.4 है, ये डायबिटीज में होता है। अगर ये 0.90 से कम है तो ये पैड डिजीज के बारे में बताते हैं। पल्सस पैराडॉक्सिस इज सीन इन पेरिकार्डियल टैप। कार्डिक टेम्पोनेट क्या है? फ्लूइड accumulation in the pericardium restrict the right ventricular expansion, shifting the anteroventricular segment to left. क्यूबिस ऑक्जुलस मतलब होता है accompanying concomitant symptom. Quiz who, quid what, ubi where. Cubus occulus. Cure why. Komodo modalities. Komodo. Which of the following statement regarding diabetes mellitus are correct? Children born to mother with gestational diabetes have increased long-term risk of developing obesity, insulin resistance. MODY, maturity onset diabetes of the young, is genetically heterogeneous group of monogenetic diabetes, autosomal dominant inheritance. Type 1 diabetes is an autoimmune condition where T cells destroy the insulin production, producing beta cell. In the pancreatic islets. Wounds which bleed profusely, especially after fall, arnica, millefolium, and hemamelis. Which one of the following remedies has been mentioned in abusive pain with chamomile? Corallum rubrum. एंग्री में है, अब्यूसिव अगर हो जाता है तो कोरलम. ISM is known for being abusive but associated with. जो अब्यूसिव गाली गलौज करता है वो पेन के समय गाली गलौज करेगा तो वो कोरलम. पेन के समय जो गुस्सा करेगा वो कैमो कैमो. हाई समझ में भी अपशब्द कहना पाया जाता है लेकिन वो जीलसी के कारण. जब व्यक्ति को जीलस हो और वो गाली देता हो तब. एनाकार्डियम में डिस्पोजिशन टू स्वेयर. Which cell is involved in type 4 delayed hypersensitivity? Cytotoxic T cell, T lymphocyte. Unique because it is entirely cell mediated, unlike type 1, type 2, and which are antibody mediated. Type 1, type 2, and type 3 are antibody mediated, while type 4 is cell mediated. It involves T lymphocyte, especially CD4 cell, helper T cell, Th1 and Th2, CD8 cell, cytotoxic T cell, cytotoxic T cells. Upon re-exposure to an antigen, these T cells are activated and release cytokine or directly cause cellular cytotoxicity. The reaction takes 24 to 72 hours to develop, which is why it is called delayed. Macrophage and dendritic antigen presenting cell that activate T cell or serve as a primary effector cell recruited by T cell. Neutrophil primarily involved in acute bacterial inflammation and type 3 immune complex. Homeopathic. Which one of the following medicine is mentioned under the rubric respiration asthmatic? Respiration asthmatic. Emulation by expectoration. Hypericum. Under respiration chapter, if you look up at the main rubric asthmatic and navigate the sub-modality expectoration emulation. This is crucial keynote symptom for hypericum when managing respiratory difficulties. Desire to be fan. Kalikar. 2 to 4 a.m. Pothos inhalation of dust. The following finding appear late in compartment syndrome. Pulselessness. Pulselessness. Pain, poikilothermia, pallor, parasthenia, paralysis, and pulse. Paralysis and pulseless. Which of the following is the correct method for measurement of nasogastric tube? Tip of nose to ear lobule to jiffy sternum. To ensure nasogastric tube is safely positioned inside the stomach rather than lungs or esophagus, must be measured carefully prior to the insertion. ट्यूब के सिरे को नाक की नोक से कान की लौ तक नापें, फिर वहां से छाती की हड्डी से निचले स्टर्नम तक नापें. According to Hanuman, which of the following best example of action occurring without material connection, perceptible only by its effect? In aphorism 11, Hanuman, the term dynamic influence, dynamic power, he explained that the dynamic action of medicine upon the healthy vital force or the dynamic influence of myopic agent causing disease occur immaterially. There is no physical contact. Hyperphosphatemia is a major cause of secondary hyperthyroidism of renal. सही है. Hyperphosphatemia impair renal synthesis of 1,2 dihydroxyvitamin D and stimulate parathyroid hormone secretion. क्रोनिक किडनी ये क्या होता है कि फॉस्फेट को बाहर निकालने के लिए अक्षम होता है, जिससे रक्त में फॉस्फेट का स्तर बढ़ जाता है। यह सेकेंडरी हाइपोथायरॉयडिज्म को जन्म देने वाला मुख्य कारण। बढ़ा हुआ फॉस्फेट सीधे गुर्दे से क्रेटिनिन के संश्लेषण को ट्रू रिब्रिक चाइल्ड रिफ्यूज मदर मिल्क चेस्ट chest milk refuses mother child. Fing continuous fluxion potency method is based on continuous water. एकदम सही है. Fing method potency is increased by subjecting a valve to vigorous manual succession. गलत. बर्नार्ड फिंक ने उच्च शक्तियों को बनाने के लिए कंटिन्यूअस फ्लक्शन का इस्तेमाल. Thyroid hormone resistance is autosomal dominant disorder. Hormone level. Inappropriately normal or elevated TSH. Resistance to thyroid hormone is a rare syndrome typically caused by mutation in the thyroid hormone receptor. It is predominantly inherited. Falling of hair from beard, head external, contain expression eruption ulcer, objective skin conditions. In Clark report, the acid among the remedies is mentioned. This abbreviation is derived from which among the following? C for report. Nay report is based on hearing guiding systems. Pathological repertoire. Gorsner desire and original focus family keynote and a specific constitutional trait. Bell's diarrhea specialized regional repertoire. Homeopathic philosophy. Quid what? Cure why? Quando when? Quid what? Cure why? Quando when? Ubi where? Komodo modalities. Patient is peevish, angry at least dreadful, hypochondriac, unreasonably anxious. A person. Extreme sensitivity. Both physically and mentally. patient is remarkably peevish, angry at least trifle. Lack canine, lack canine dog milk, lack felinum cat's milk, lack vaccinum cow's milk, lack defloratum skimmed cow. Delcamara whole plant, bark of root, fresh. Check for purity of glycerin. All the following tests are used except methane.